Good morning, and thank you all for joining us today, which is our first webinar in the 2025 series. So we hope you enjoy the webinars this year, as they've been specially requested by stroke survivors in the Facebook group. We'll be having one a month for the next 8 months, so we hope you join us again. If you wish to watch any past webinars, go to our website, select stroke information, and you'll have a drop-down menu, and on there you'll see webinar library. Click on that and it'll bring them all up. We've got a host of topics on there, and that's where any from this year will be stored as well. So we are recording today, but it'll only be myself and Dominic who's presenting that will show on screen. So don't worry, if you're in your pajamas, that's fine. We would welcome your suggestions for any future topics as well. And you'll have a feedback questionnaire at the end of the webinar today. It's just a few questions. And there's a section on there to leave suggestions for next webinars, or if you think of it at a later date, please just email us at info@differentstrokes.co.uk. So we have a chat function down the bottom, you'll see. Please introduce yourselves to the others and where you're watching from and everything if you wish to. We also have a Q&A section. If you have any questions for Dominic to answer at the end, please put them in there. If they go in the chat function, they might get lost, but please, if you have any questions, pop them in the Q&A section and I will ask Dominic them at the end. So today we're joined by Dominic, who is an assessment manager for the regional driving assessment centres. So Dominic, I'm going to hand over to you now. Would you like to introduce yourself?
Thanks, Sheila. Yeah, so my name's Dominic. I'm one of the assessment managers for RDAC. I'm going to show you a PowerPoint presentation which will explain what RDAC is as an organisation and how we're governed and what we're here to do, really. My job as an assessment manager is to make sure that when clients come and see us, that you're getting a good level of service, you're getting a detailed report, and you understand what the next steps are following that assessment. So I manage a team of driving advisors and occupational therapists and hopefully make that process go smoothly for you. So I'm going to try and share my screen with you now. Okay. So RDAC is a charity, and Sheila, can you see a slide with driving mobility on now? Has
Yes,
that
I think
changed?
you need to pop it into slideshow mode to
Yeah, let's do that.
enhance it a little bit.
Fab, does that look better?
It does, but we've got a
Yeah,
different
I'll
screen
scroll
there.
through.
There
Are we
we
there?
go. Driving
Fabulous.
mobility.
There
Yeah,
we go. There we go. Right.
excellent.
So Driving Mobility is another charity. And Driving Mobility are commissioned by the Department for Transport to accredit driving assessment centres up and down the UK. A really good way of thinking of them is they're a bit like Ofsted for schools and a bit like the CQC for healthcare providers. What it basically means is whether you come to RDAC or you go to another provider that comes under the driving mobility banner, you should get the same level of service, you should get the same outcome, and the same quality of report advising you on what the next steps are. RDAC centres, we have two accredited centres which are main sites. They're in Meriden, which is somewhere near Birmingham, and one in Manchester. Um, they're the centres that will be checked by driving mobility, and then we can operate outreaches and satellite centres from those accredited centres. In terms of where we get our referrals from, We do get them directly from the DVLA. So if you notify the DVLA that you've got a medical condition, then the DVLA will sometimes ask us to do an assessment on their behalf. We do them for legal and police. Motability, so if somebody's going to lease a car through that scheme, they will often ask us for advice on what appropriate adaptations there are. You can refer yourself to us, and we also take referrals from health professionals. The big advantage of getting a health professional to refer you is currently it is free. That is likely to change come the new financial year, but a health professional referral will still be a cheaper option than referring yourself or any of the other sources. So the assessments we provide, we're called the Regional Driving Assessment Centre, but we do a whole host of other things. So we can look at people's medical fitness to drive. We can look at vehicle adaptations for driving. We can also help passengers. So somebody, if you've had a stroke and you're a passenger and getting in and out of a vehicle is difficult, we can look at solutions that could help you and adaptations to the vehicle that would make getting in and out of the vehicle easier. Equipment loading, so getting scooters and wheelchairs into vehicles can be difficult. And there's a range of equipment that can help people remain as independent as possible by taking the weight bearing really of that equipment to get it in the car. Try before you fly is related to access to aeroplanes. Pediatric, we do see children who need specialist car seats, powered wheelchair and mobility scooters. And the hub service is an aftercare service. So traditionally, when people came for a driving assessment, we would give the advice, and that would be the end of our involvement. What we want now is to have a bit of a follow-up service, and where people do have to stop driving, there's information there for them to help them keep as active in the community as possible. So the big one, the importance of driving, and this is why we exist. So our aim is to keep you driving. It is not to get you off the road. When it comes to driving, it's not just being able to drive a car, it's being able to get to your job, it's being able to go and see your friends. And especially when there are physical limitations, we take for granted that actually nipping 5 minutes down the road to the shops can be quite difficult. And that car gives that freedom for somebody to be able to remain independent. Social inclusion and loneliness is a massive problem in our society that we don't think of as much as we should do. And as much as people will say, I can give you a lift, I'll come and pick you up, sometimes they don't want to. Sometimes it becomes an overbearing thing and people start off doing it and then it dwindles a little bit. So we the ability to drive a car has such an impact on people's quality of life. It's really, really important. To drive a vehicle in the UK, you need some form of driving entitlement. When you learn to drive, you get a provisional driving license. When you pass your driving test, you will then get a full UK substantive driving license. And that license will generally be in place until you're 70 years of age. And at the age of 70, you just need to certify to the DVLA that medically you are still fit to drive, and your license will get renewed on a 3-yearly basis. The DVLA do restrict some licenses, so you could be given a 12-month entitlement, and again, you would need to justify to the DVLA that medically you remain fit to drive, at which point they'll consider renewing on that yearly basis. When it comes to medical conditions, it is the driver's responsibility to notify the DVLA if they've got a medical condition. And it's any medical condition that could impact on safe driving. Now, when it comes to strokes, if after the first calendar month there are no cognitive and no physical effects from the stroke remaining, then you don't need to notify the DVLA. You can just return to driving at that point. If there are any physical or cognitive effects remaining from the stroke, then you do need to notify the driver's medical group. And I'll explain on one of the next slides what the driver's medical group will then do with that information. So when it comes to notifying the DVLA, they have a list online of medical conditions that you need to report, but essentially anything that could affect safe driving, they need to know about. So your health professionals may advise you on the impact of safe driving. They may refer you to a mobility centre for an assessment because they can't make a decision based on the clinical records they've got at that time. If a health professional has advised you not to drive and you continue to do so, they are able to notify the DVLA, and they are able to notify the DVLA without your consent. And that is guidance that in particular has gone out to doctors and occupational therapists in the last few years. And the reason being, it's in the public interest. When it comes to notifying them, you don't need to go into loads and loads of detail. You just need to tell them that you've got a medical condition. They will then ask the questions of your clinicians that they want to ask. You can do this online, or you can do it over the phone with the phone number that's there. So when you tell the DVLA have their own medical branch, which has doctors and nurses in it. They'll have a look at your medical condition, what information they've got on that, whether there's any physical difficulties or any cognitive difficulties. They then may go and speak to your own clinicians or the consultants who you've seen, and ask for advice on whether there is any issue or concern around you returning to driving. From that, they'll then make a decision that either yes, we're happy, return to driving. We've got serious concerns from what your clinicians have said, and we're going to revoke the license. A lot of cases will fit somewhere in the middle where there's not quite enough clinical information for them to make that concrete decision. And that's where the DVLA would ask you to come to one of our centres for us to have a look at your driving. A big, really important thing with the DVLA is if you don't comply with their process, they are likely to just revoke the license. So when you come to one of our centres, you're going to see an assessment team which will have two members of staff. The first one is a driving advisor who is a registered, approved driving instructor, but they've undertaken further courses, which is currently a university course, and that's in driver behaviour and relating that to medical conditions. They will work with a health professional across driving mobility. RDAC's choice of health professionals is occupational therapists. The OTs, again, they will undergo further training, which is the same that the driving advisors do, which gives them an underpinning of driving behaviours that would be related to certain medical conditions and how that can be impacted. The assessment team will work together, depending on what type of assessment you've come for, to give the best recommendations they can. And there's a whole host of recommendations they can make. A really simple way of thinking of these two members of staff is the driving advisor is an expert in good and bad driving. The occupational therapist can qualify whether any concerning behaviours are related to your medical condition or not. And that's a really, really important decision to be made because our role is to look at your medical fitness to drive, not whether you're a good or bad driver. So when you come and see us, the first part of this, using the word interview, is very strong. We want to have a chat with you. We want to find out what medical conditions you've got, how you feel that you've been impacted by those medical conditions. And again, that's really, really important because the information from the referrer is useful, but you're living with that medical condition or the medical episode you've had. So you're the expert in it, really. We also want to know about your driving history. And again, that's really important because different drivers have different levels of experience. So if you're somebody who passed the test 60 years ago, have driven twice a week, 5 minutes down the road, your level of skill is going to be very different to somebody who's been a roads policing officer, a HGV driver. And that gives us an indication of things that we might need to give you a little bit more support with or a little bit of coaching on how to deal with, and what could be a training issue as opposed to a medical limitation. Once we've had that chat, we'll potentially do the two next steps. So the physical assessment, what we're interested in with the physical is your range of movement related to driving. So everything is done from a sitting position, and it's all relatable to what you would do in a car. Now, it could be if the clinical information we've got is that physically you've not been affected. We've seen you walk into the centre and there's clearly no physical limitation there at all. We might not do this part of the assessment. So this is a clinical decision on the day, and so is the cognitive screening tests. Now, these are pen and paper tasks. There's a range of 12 different tests that you could be asked to do. Again, if your own health team have done cognitive screens and they've all come back really well, we might not repeat them. And this is down to the occupational therapist on the day to decide, is this relevant? Is it going to give us anything? And is it going to help with the quality of your assessment? When it comes to these cognitive screens, they are a screen. They are not a conclusive test. And they give us an idea of what we might see on road. And it doesn't always correlate. Most of the time it will. But there's a whole host of other reasons that somebody might struggle with pen and paper cognitive tasks. It's also entirely possible that somebody could do well on the cognitive screens, but actually, when put into a more complex environment, cognitive issues do start to show up. And driving is one of the most complex cognitive tasks that we do as human beings. So, after the cognitives, we go outside and we would ask you to read a number plate from 20 metres. This is a legal requirement that the DVLA have. And one of the issues we sometimes have with the visual assessment is that the DVLA standards of vision has two parts to it. So there's having a visual acuity. So the optician will do a test on a Snellen chart with you. And sometimes people can do really well on that and be told by the optician, yep, your eyes are fine for driving. But when it comes to reading the number plate, there's a difficulty. And you must be able to do both. You'll get 3 attempts to read the number plate on the day of the assessment. The first two will be with a white background with black letters and numbers, and the third attempt will be with a yellow background. Now, if you struggle with the eyesight, if you've been referred by a health professional or you've referred yourself, what we would do is advise you to go and see the optician and see if there's any tweaks to your prescription they can do. And we'd then ask you to come back in 2 to 3 weeks' time where we'd complete the rest of the assessment. One thing that's really, really important for you to be aware of with that element is if you didn't return to the assessment centre, we would have to send the original report from that first assessment to the DVLA to notify them that you couldn't meet the eyesight requirement at that stage. The other difference is if the DVLA have referred you, we would have to notify them immediately, and we don't have the freedom to give that grace period to go and get your eyesight corrected. So providing everything's okay with the number plate test, we would then go out in a car. Now, If you have come to look at adaptations and there's no cognitive concerns, then we would have a look at what adaptations are going to be the most appropriate ones for you, and we'll give you an opportunity to have a go with those adaptations. We are not looking for you to do a perfect drive with them at this stage because this assessment will be about working out what you need to return to driving. Most cases, we're going to advise some tuition following that assessment. Um, in very, very rare cases, people get in a car and they adapt to them very, very quickly. But that period of tuition would be down to you where there's no cognitive concerns to have that tuition and make sure you're at a good standard to drive independently with the advice of your instructor. Um, if there are cognitive concerns where it's an adaptation assessment, we would then ask you to return following tuition and we would do a full route with you. Um, if there are cognitive concerns, then the assessment is going to be a fitness to drive assessment. And that assessment mirrors the driving test in that it's around the same length of time. And that is where the similarities stop. So, what we're interested in on this assessment is whether the stroke is affecting your ability to drive safely. So, we are not interested in your bad habits. Um, Obviously, if you're doing 60 in a 30-mile-an-hour zone, we're going to question cognitively your awareness of what's going on and your decision-making capabilities. But things like crossing hands over on the steering wheel, driving with your hand on the gear stick, creeping over the speed limit by 2 or 3 miles an hour every now and again, we're not too interested in that. What we want to see is one, that you can physically control a car safely, and two, that you can make sense of what's going on around you. You've got the ability to divide your attention. You can process information in a timely manner. All things that would relate back to the stroke. Um, we want you to do well on this assessment. We do not want to have to identify that there are issues, but we will give you an honest assessment from that drive. Now, at the end of that drive, it could be that we have identified some problems and that currently you are unsafe to drive, but we think you need a bit more recovery time. And it might be that we say don't drive, but come back and see us in 6 months and just give yourself time to recover a bit more. And I I suppose physically when you injure yourself, you can see when you're getting better. When there's a cognitive element, it's very difficult to see the brain repairing itself and healing. And sometimes that does take a bit more time than we want it to. Um, Hopefully, we're going to turn around and say, there's absolutely nothing wrong with you driving, return to driving. Um, it could be in some cases that you've had a significant amount of recovery time and things haven't fixed themselves well enough and it's time to stop driving. In that scenario, we would recommend that you voluntarily surrender your license to the DVLA. And there's a real importance with that because if you surrender your license, if you then have further recovery and want to return to driving, it's a much easier process if you've given the DVLA your license and taken that responsibility. When the DVLA revoke a license, it's a much more difficult process to go through to get that license back. And this leads into a bit of a licensing thing. If you've surrendered your license, when you then reapply for your entitlement back, providing you meet certain criteria, you could come in and see us before the DVLA have made a licensing decision. And that's a section in the Road Traffic Act called Section 88. And I can send some information out on that through different strokes and you can have a look at the criterion if that was the case, whether you would meet that. So at the end of the assessment, the assessment team make a joint recommendation to you. and they will then follow that up with a report that they'll send out to you. Currently, through the post, we're potentially going to be moving more online as we move forward, and that will just outline what's happened, what the concerns are, and what we recommend you do next. So functionally, these are the things we're looking at. So your limb function, can you operate all the standard controls of a vehicle? Now, physically, there is not a lot we can't make a recommendation for in terms of solving problems. There are in some cases limits to what we can recommend. Um, but things like your sensation, can you feel what you're touching? What are your pain levels like? So if you can use your right foot to operate the accelerator and brake, but actually after 10 minutes you're in a lot of pain, that's going to distract you from a lot of the other things that are going on road. So actually it might be better to move to an adaptation to make sure you can retain that independence. Proprioception, do you know where your limbs are in space? And this causes major problems with pedals. So if you're not sure where your foot is, there's a high chance you're going to push the wrong pedal, which particularly with the accelerator and brake is going to cause massive problems. Posture, again, if you're not sat in a good position, if you're not comfortable, that's going to be another distraction for you. And the cognitive elements of driving. So I've mentioned some of these already. Um, we want to see a safe drive, not a perfect drive. We want to see that you can make sense of your surroundings. You understand what road markings mean, what road signs mean. And there'll be certain elements in the drive that will bring out these cognitive elements. So mandatory turns, there could be some no entry signs, which mean you've only one option in where you go. Um, the routes will generally start off quite simple, and they'll become more complex as time goes on. What this would highlight to us is whether you can sustain and divide your attention, in particular the dividing of your attention as you get into more complex areas. There might be multiple lanes, there could be lots of pedestrian activity, traffic lights, pedestrian crossings. Can you deal with all those multiple pieces of information all at the same time? Do you understand what to do on a roundabout? We do see with some clients that they could join a roundabout, for example, not sure where they need to leave, and they stop the car whilst negotiating the roundabout. So that memory of that wouldn't be appropriate in that scenario. Road position. So this would identify whether there's any visual spatial difficulties, and would often show itself by somebody being over a lane dividing line, over the centre line, driving towards oncoming traffic. Can you deal with changing road conditions? So temporary traffic lights, for example, unexpected things that happen. Somebody walks out in front of you and you have to adjust what you're doing and change your driving plan. So vehicle adaptations. This is a very brief overview of adaptations. There are so many different ones out there that can help you with driving. But this slide shows us a swivel seat, which does what it says on the tin. It swivels out of the car. They can raise and lower in terms of height. And these are quite useful for somebody who needs to transfer from a wheelchair onto the driver's seat or the passenger seat, but actually getting in through the door opening is difficult, and the seat would then swivel you into position. Anybody who's tall is going to struggle with one of these, and it won't necessarily be appropriate, but it's good adaptation for some people. Rooftop boxes and hoists. So the rooftop box will lift a foldable wheelchair up, pivot it, and slide it into a box. And the hoist, which would go in the boot, that just takes the weight off of the person lifting it into the vehicle. So you would still need to guide it in, but you've not got the weight bearing to do. Drive from wheelchair vehicles, so you can drive into a vehicle and dock your wheelchair in position and drive from it. Um, for some people, this is an absolute blessing, and you can even have docking stations that will dock automatically. Um, these will typically have fire extinguishers in them under the bonnet, and that's really important in terms of giving people more time to get out of the vehicle in an emergency. And these would be bespoke vehicles with the relevant driving controls fitted. The picture on the right is your most basic form of hand controls. So you've got a steering ball on the upper left quadrant of the steering wheel, and to the right of the steering column is a lever which has a metal bar that goes down onto your brake pedal. So as you push that lever away, it's pushing the brake pedal down. There's then a cord halfway up that will wrap round onto the accelerator. So as you lift it towards you, you're actually pushing the accelerator pedal down. There's a blue toggle switch on the top, which will indicate left and right. So most of the functions can be done with one hand accelerating, braking and indicating, and the other hand steering. The picture on the left, underneath the steering wheel is a ring, and that ring is an accelerator. So you can push it away or pull it towards you with your fingertips, and that will send a message to the engine to accelerate. The lever on the right-hand side of the steering column here works in the same way that the other lever does, just as a brake though, and you would push it down to the floor. The push downs are significantly easier and require less strength than the push aways. The ring accelerator can also be on top of the steering wheel. And then these are steering aids which have secondary controls attached to them. So if you've lost the use of the right-hand side of your body, we need to find a way that you can drive with just the left-hand side of your body. So you would steer with your left hand, and these devices can indicate, operate your windscreen wipers. You can even wash the windscreen with them, sound the horn. And this would generally go hand in hand with a left foot accelerator. So here we've given all the driving responsibility over to that left-hand side. This particular accelerator is called a twin flip. So there's a folded up pedal on the right-hand side of the brake, and this would enable somebody who needs to drive with their left foot, but has a family member who also wants to use that car but drive with their right foot. All you do is pull the other pedal down, and the one on the left would fold away. And then high-tech controls. So in a nutshell, it is possible to drive with a four-way joystick. Not the easiest method of driving, but it's entirely possible. Where you would just with the movement in your wrist, push to brake, pull to accelerate, and pull it to the left and right to steer. Motability. So Motability are there's two strands to Motability. There's Motability Operations. They are a car lease company where you can exchange, if you get the higher rate of the mobility component of PIP or DLA, then you can exchange part or all of that allowance towards the leasing of a vehicle. The advantage of the Motability scheme is that they will subsidise the cost of adaptations, and it's put onto the lease of the vehicle. The disadvantage is, depending on when you've had your stroke, you may be too old to qualify for PIP and then have the Motability scheme open. The Motability operations also have a foundation charity who can provide grants for people who need additional financial support towards a Motability vehicle. And that is the presentation.
Thank you very much, Dominic. Hopefully that's answered some of your questions and queries that always come into us about driving. Now we've had some questions in advance of today. If I can just ask you them, Dominic. The first question is, how can I improve my driving at night? I have no confidence driving at night and usually try to get my partner to drive, but I would like to be independent at night. I find it takes much more concentration than day driving and constantly adjusting the lane so that I can drive in a straight line. Any tips for driving at night? Thank you.
That's quite a difficult one to answer, and especially without a bit more context as to what's causing the issue. As we get older, our eyes do generally start to struggle a bit more driving at night. It's not helped by headlights having got brighter and brighter, and driving at night is also generally more difficult anyway, purely because of the light levels. It might be worth if that person wants to make contact directly, I can have a discussion with them about specifically what causes them a problem and what may help. I'm 41. I find it more difficult driving at night than I did when I was in my 20s. The main thing for me is the brightness of headlights that causes a problem. If if headlights are dazzling you, averting your gaze a bit more towards the curb can help a little bit, but you obviously need to keep enough focus on the wider picture as you're driving along. But I'm happy to have a follow up with that person individually and see if I can be a bit more specific and sort of guide them a bit more with a bit more discussion.
That's lovely. Thank you, Dominic. The next one is likelihood of being accepted as safe to drive with a visual inattention neglect diagnosis.
Yeah, this is a very easy one to answer. You won't. So if you clinically apparent visual inattention or neglect is debarring for licensing. So if that has been diagnosed and it's clinically apparent, you cannot drive in the UK and the DVLA would revoke your license. What clinicians in particular need to be very careful with is the words visual inattention and neglect are bandied about a bit more frequently than they should be. So they need to be very clear whether they are diagnosing that or whether they're. Sometimes it's just a case that there are some spatial awareness difficulties, but it's not actually an inattention or a neglect. And I would seek more expert advice as to whether there's an inattention or neglect present before committing to that. There is potentially going to be a trial running later this year, and this will involve our centres where if currently if visual inattention or neglect is mentioned on a referral, we will reject the referral, and the advice will be that you need to notify the DVLA and the driver's medical group will decide whether it's clinically apparent or not. The trial will be to look at actually getting people into one of our centres and looking whether we feel there is a neglect present and whether that's going to impact on driving. That will then go back to the DVLA and there'll be further discussions at that stage. But that's not live yet, and it's in the very early stages. But yeah, it's a debarring condition.
Thank you. And how does insurance work after you've taken the driving test?
Now, this is a very interesting question because you should not be discriminated against for any medical condition or any disability. So in terms of premiums, you should see no different. Now, one thing insurance companies will potentially do, if you're driving a car with adaptations, they may increase the premium, but their argument will be it's not because of your medical condition or disability, we're increasing the premium because you've got a modified car. Now, I would encourage you if you did have an increased premium, they might increase it a bit anyway, and there's not much you can do. Some insurance companies have been known to disproportionately increase a premium, with one insurance company increasing somebody's premium by £5,000 a year. This this person challenged that, and they challenged it all the way up to the chief executive of that insurance company, and the premium very quickly came back down. I think there might have been an MP involved with that one as well. But yeah, you need to tell your insurance company if you've got a medical condition, and you would need to tell them if you're driving with adaptations. But if I would challenge any disproportionate increases in premium.
Lovely, thank you. And we'll move on to the questions from today.
Yep.
There's three about centres, so I'll ask those first. Is there a driving assessment centre local to Hampshire?
Oh, that's a difficult one for me to answer. Being a Yorkshireman, I need to I need to look where Hampshire is in the country. Um, the the easiest way for you to check would be if you go on Driving Mobility's website, there is a feature to search for a centre, and what you can do is put your postcode in, and the postcode will then tell you where your nearest centre is. Just looking on the map, so excuse me, our closest centre to Hampshire would be our Oxford site. However, there is a centre in Bristol, and is a centre in there's a centre called Ability. But my geography is not going to be amazing here, I'm afraid. That might be a little bit more east. But there are centres in the south and below London. Bristol might be the closest.
Okay, that kind of covers another question that says, I noticed there are no centres in the south. Is it a separate organisation that covers the south of England? Thank you.
So they are all the accredited centres that are approved by the Department for Transport and the DVLA are part of Driving Mobility. So using that function on the Driving Mobility website will tell you whether somebody else covers that area or not, and the distance. It'll give you the top three centres and the distance they are from you. Nationally, there are only 24 centres, so it's a massively undercovered area, and hopefully that will improve. It has increased over the last 24 months. We were 20 centres a couple of years ago, and the way we operate is we are given regions, so we have to bid for a region. So we can't just encroach on. We have a centre in Manchester. There's another organisation that are part of Driving Mobility in Leeds. We can't just go to Leeds and say we're going to open up a centre in this area, because that is they've got the rights for that area really. There there aren't enough. We have more centres sort of Midlands and North. Oxford is our only southern centre currently, and I guess part of the reason is it's a lot more expensive to operate in the south than it is in the north.
Lovely. And somebody is asking, I know you said main centres are Manchester and Birmingham. Does the patient need to get to these centres, or are there other centres that can be used in their local area? So you kind of covered half of that question already.
Yeah, so we do operate outreaches. So the Manchester site has an outreach in Humberside of all places. So it's a good 2.5 hours away. But in Hull, we do have an outreach there. The site in Meriden near Birmingham has outreaches in Cannock, Worcester. There's an outreach in Northampton, one in Leicester, and Wolverhampton. So we operate outreaches where we can, but for every outreach we open, there's an increased cost for operating that additional building and the vehicles we need to have there. So you would need to come to one of our centres. We can't come out to you and do the assessment, and part of that is because the route has to be an approved route. So I can't do a medical fitness to drive and just make the route up as I go along because it's got to have certain features in it.
Excellent. So everybody's scrabbling to look on the on the website now. Right. The last question we've got for today, I think, is I have undergone an RDAC assessment, and they faulted me for anxiety and hesitation on roundabouts, which I felt was rather unfair at the time as I was severely fatigued and anxious. They told me to try an assessment again in 6 months, but they never got back to me. Right now, I don't know if I can drive or not, so I haven't.
Okay. So the recommendation for further recovery, that would be, and it should have been made clear, and if it wasn't made clear, I'll apologise for that. After that period of recovery, we would ask the client to make contact with us to book a review. Years ago, we did follow it every assessment up, but as we've become bigger, we don't have the capacity to contact every client who's asked to have further recovery. So we do shift the onus back onto the client now to contact us. If whoever's asked that question would like to contact me directly, I can have a look into that, and I'll be able to give you a specific, definitive answer as to where you're at, and what steps you need to take. So my email address, it's being recorded, Sheila, I think, this session, isn't it?
Yes, it is.
So at the end of the presentation, my email address was on there. So if you want to have a look at that and send me an email, I can have a look into that for you.
Okay, as well, if I put my email in your answer, then you can email me and I can pass it on to Dominic if you missed Dominic's email. So let me just do that quickly now. While I'm doing that, thank you so much, Dominic, for helping us today
You're
and
very, very
answering
welcome.
these
Very welcome.
questions. It's a bit, it's like anything to do with stroke. It's a bit of a minefield, and what have you, but hopefully it'll be very helpful. Um, Now, all we've got to do is, as I say, any questions, please email into Different Strokes and we will try and pass them on to Dominic and he will try and answer them if he can. So please don't feel this is the end of it. As I say, we're always here for questions, and now we've got our expert to fire them at. We're ready to go. So thank you again, Dominic, and for everybody watching, thank you for joining us today. And please fill in the feedback form at the end and keep an eye on our website for the rest of our webinars this year. I think the next one is going to be at the end of April, and that will be coming shortly to the website and socials and what have you. So once again to everybody, thank you again, and we hope to see you the next time. Thank you.